Welcome to Built to Heal. I am Dr. M, your host, and I am here with my parents and my partners, Dr. Bob and Dr. Ann. And we are super excited to do this Pinto exclusive podcast conversation about one of our favorite modalities, Shockwave. And so what we're going to talk about today is what exactly is Shockwave, why StemWave is our favorite personally, and share some patient wins and kind of explain a little bit more about who's a good fit for this. And so first off, right off the bat, what is Shockwave?
What is Shockwave?
What is Shockwave?
Well, Shockwave is a device that produces a impulse into the tissue, if you will, a shock wave into the tissue. And it does a lot of things. It produces inflammation. The depression of the cell walls creates a biochemical what am I looking for? Biochemical messaging of the cells to produce protein. And how do you heal? You heal with protein. Protein synthesis is the most important part of healing.
Yeah. Awesome. And that's an incredible part about Shockwave and how it does the regenerative aspect of things. But it's kind of curious to think about how Shockwave originally developed. It was for lithotripsy, which is actually breaking up kidney stones.
Right.
And so what I talk to patients about all the time is that this type of technology is sound waves. It's called Shockwave, and it's a very particular type of acoustic wave. But this is sound. And when we direct sound into tissue, we can actually break things up like a kidney stone. That's more of a calcium deposit.
I tell patients all the time, it was like, I think what happened was podiatrists saw the kidney stones being broken up and they said, ooh, what about a heel spur?
Yeah.
And so they did it on heel spurs. And that, I remember when that was a really big thing in podiatry where they were using this new technology to break up heel spurs. And I think from there, orthopedists went, well, if it'll break up heel spurs, maybe it'll break up calcific tendonitis, which is a very, very common issue with rotator cuff injuries and things like that.
Yeah.
So that's my take on how it developed.
Yeah.
What those guys were thinking when they did this, you know?
Yeah. And the shock name, too, I think is interesting because I do think a lot of people, because there are electrical therapies that are shocking, right?
Yeah.
However, it is the shock that creates the sound, which, you know, and I think that's where the shock wave came from. But I think, you know, we like to sometimes just refer to it as acoustic wave therapy because it doesn't sound quite so shocking, just because people obviously don't want to be shocked.
Yeah, definitely.
Just a little FYI there. The shock itself is what it's called that because there is an electrical shock produced in the water, the salt water that is in the applicator, and that is what makes that sound, which I believe travels at like 33,000 miles an hour through your tissues. So that's pretty cool.
Whoa, that's something I didn't know.
It's fast.
Yeah.
It's very fast.
Yeah. So it can break up scar tissue, it breaks up adhesions, it breaks up calcifications. You literally can reduce the size of bone spurs. I saw that on my own patients. And you can see the complete resolution of calcific tendonitis on x-ray, which is very impressive. And so we get all these mechanical benefits, but as you alluded to, Dr. Bob, you get the cells to react to this.
Yep.
And how I describe this to patients is like, your cells that are inflamed are on guard. They don't want to get hit with anything, right?
They're stiff.
They're stiff. They're like, don't mess with me. That's why it hurts when you bump something that's already hurt, right? It already inflamed. And when we jostle them with these acoustic sound waves, I literally think about it as little guys in there freaking out, like Chicken Little. And I'm like, oh my gosh, they're sending out this signal to the rest of the body that's like, guys, this is not a drill. It is serious. We need help right here, right now. And that cellular communication gets, you know,
Helps.
communicated
Recruits, yeah.
to your immune system, which is going to send more circulation, which is going to send more blood flow to that area. And then also your brain is also getting the signal, hey, we're undergoing a major earthquake. We need help.
Yep.
And that releases endorphins from your brain, which is actually just trying to help you with natural pain relief. We see that with people when they undergo traumas or undergo injury. At first, you might not feel the pain because of endorphin release. This is a protective mechanism that is built within our bodies. Our bodies are built to heal. And so it is really cool how this technology can capitalize on all of that. And so I love this technology. And another thing that I think is really important is that there's a bunch of different types of shockwave.
Right.
And so I kind of want to explore the difference between radial shockwave, which looks more like a gun, like a pulse gun, versus a focused electrohydraulic shockwave, which is what the machine we have is StemWave.
I think an interesting point here is that when we first started exploring the idea of doing this, of course the one we got is the most expensive one, and Dr. M came back and said, "No, this is the one we have to have." And I said, "Yeah, but the other ones are half the price." But the results are so much better. I think I'm going to let you talk about how what the radial one is more like a expensive.
I call it a bona fide Theragun. It's a medical grade Theragun is really what it is, because what a radial device is, if you look at what a radial, I honestly Google pictures to show patients. I'm like, did you have something that looked like this? It looks more like a gun. And with that, it's a focused pressure wave. And so it is literally oscillating pressure, almost like a Theragun, to help with breaking up adhesions, bringing more kind of concentrated inflammation to that spot so that your body responds to it. Still can be very effective. I mean, there's fantastic studies with radial shockwave for more superficial tissue.
Right.
And so that was one big thing that we were kind of exploring is you brought up radial shockwave. We were looking at radial. And then you and I were having a big discussion about, do we do soft wave, which was unfocused electrohydraulic, or do we do StemWave, which is focused electrohydraulic? And so that was a big discussion that we had as well.
You actually came back with SoftWave because that was the vendor that you saw, which caused me to want to research it. And then I found StemWave, and I was like, whoa, let's look at StemWave versus SoftWave.
Yeah.
And we did a lot of research to find the one that we really thought was best, and put a lot of effort into figuring out which one was going to be best for our patients.
Definitely.
Sure. Yeah.
I think one of the big things with the radial versus the focused is the radial doesn't penetrate nearly as deeply. I think the focused shockwave goes up to like 10 centimeters or something like that.
8 to 12.
8 to 12, yeah.
Yep, absolutely. And so that was a big thing for us too, is just what we're dealing with as physical medicine rehab and chiropractic. Like when we're doing things, a lot of times we're dealing with deep things like the spine, the deeper joints like a shoulder or a hip. And we actually really need that depth of penetration to actually create a healing response in the areas that we need it most.
Yeah, I look at it as if with the soft wave or the radial ones, that you get benefit because you're stimulating the muscles that surround these tissues. But we're actually getting into the tissues that are the problem, not just the muscle spasm around it or things like that.
Exactly. And so for us, StemWave, with being a focused electrohydraulic unit, was hands down one of the better types of just technology and tools behind it. And then we were just so impressed with the company as a whole.
The company is amazing.
Yeah. And so
wonderful support and wonderful research and all the things. So.
Shout out to the StemWave people. You guys are amazing.
The training is amazing.
Yeah, absolutely. Absolutely. Yeah. But so that is kind of a big thing, is just, again, we wanted to pick the right thing for our patients. And I think it's really cool on how it works. And so, Dr. Bob, I was just curious on if you could walk us through what a mapping process is. What exactly is mapping when we talk about that?
It's really, really cool because you see such dramatic responses when we do this initial mapping session. And what we do is, say for a knee, for instance, you cover the area with gel, and then you take the shockwave head or applicator, and what you're doing is you turn up the volume a little bit, and you're looking for points of pain, because the point of pain is where the problem is. And once you find those, we document where they are and the level that it took to stimulate it. And after we document those areas, then we go back and treat it. And I will tell you, in the 37 years now that I've been in practice, I have never seen anything that is immediate response like this does. Mm-hmm. So we'll go through and we'll treat. Well, actually, let me back up a little bit. The first thing we do is have the patient do what we call a provocative motion. Mm-hmm. And sometimes with patients, it's squatting, or with the shoulder, maybe it's just range of motion. We have people sometimes go up and down the stairs because the stairs are the worst thing for me. So we will video them going up and down the stairs or squatting or range of motion or whatever it is. And then we map and then we treat. Mm-hmm. And then we video again the motion. And what you almost invariably see is a dramatic increase in the range of motion. Mm-hmm. And it's, again, not to overutilize this cliche, but it's shocking to me what we see with this thing, because it's crazy that people can squat down to like 20 degrees and all of a sudden they're going to 90 degrees. Right. And that happens more often than not.
Right. And it also is decreasing their pain. So that range of motion, if it was limited by pain, that's what has allowed the increase. Sometimes that range of motion isn't necessarily just limited by pain. It's just limited by the actual ability to do it. And then all of a sudden, we've seen so many people stand up and just have tears running down their face because it's like, I never thought that I would be able to do that ever again in my life. And it's just so cool. I love also the diagnostic capabilities of it. It's so cool because when you have that applicator head over an area that is not inflamed, it feels nothing but like a tap. Yep. And so when you get over that inflammation and you elicit that pain, it's like, okay, well, that's where the problem is. Because a lot of times the way our nervous system works, right, they'll say, oh, well, my pain is, say in my thigh, when it's not. But we go over that with that applicator and there's nothing there. And then we're like, okay, well, this must be a referred pain from somewhere else. This isn't where the problem really is. And that's huge also, because I think a lot of times, you go to a physician and you say, this is what hurts, and then all of the focus is just on that one area, and that's not really what's causing the problem. Mm-hmm. So it's just that aspect of it, I think, is really tremendous too.
When you think about that, and so often a patient will come in and say, it hurts here. Mm-hmm. Well, guess what? If they went to the orthopedist or somewhere else, that's where they're going to treat.
Right. Mm-hmm.
But when we do the Shockwave,
sometimes there's even surgery on areas. Yeah. And I mean, I know that people out there have had that experience or heard of someone where, you think that this surgery is going to fix the pain and it does nothing for it at all because it actually wasn't what was causing the problem to begin with. So.
Yeah, it's huge. It's huge in diagnostic. And I think it's really cool to also just receiving Shockwave because, like, as you said, like, if you have no inflammation in that area, you genuinely just feel like a tapping sensation. It makes a loud noise. We wear protective headgear when we're listening.
All of us do.
But it makes a loud noise and you feel like a tapping sensation. But then when you go over that inflamed area, it changes. And I always warn people because they're like, oh, is it like a TENS unit? Is it like this? And I'm like, no.
Not at all.
It almost replicates the pain that you've been feeling, right. But you want to feel it and feel like it's doing something, but you never should get to the point where you're pulling away or flinching or anything like that. Right. And that's a huge thing from a practitioner standpoint too, is that, and patient, is that you don't want people to be in significant amount of pain while they're doing these things because they're not going to want to come back, and they're not going to want to do the treatments or be compliant with doing the treatments.
Right. And in addition to that, I think the body, if it is causing too much pain, your neurological systems then set something up so that then I think it can be actually somewhat detrimental as much as beneficial because you've crossed that threshold of comfort. Yeah. So I think as you were saying, we always try to keep it between like a 3 and a 5 on a pain level, which is why we start off on that lower frequency and increase it as we go.
Yeah, when we do it, we actually have 2 practitioners working on a patient. One, which is what I'm doing, is generally me, and then we have somebody that manages the volume because, again, it's really important to keep that pain level between a 3 and a 5, and that's something that most people can tolerate really, really well. Right. Mm-hmm. But we can do that by managing how much we're applying to the area. So we try to keep it in that area, and that's when it also is most effective. And generally, people will go through this, and they'll wince a little bit when we hit the spots. But no, keep it down to a 3 or 5, and it's only a few minutes as well. So that's another big part of it. Yeah, there's a little bit of pain when you do it, but it's only for a couple minutes. And when it produces those dramatic results, people are signing up right now. Yes, I'm going to do this. I'm going to do this. Never seen anything like that, again, in my 37 years where people are like, yes, we're going to do this.
Definitely.
And it is one of those things where we have to educate people, Dr. Bob, because so many people think the more pain, more gain, and it is not the case.
Yeah, more is not better in this circumstance.
We have experienced that with a couple of people. You'll get a guy come in who's tough and has a higher pain threshold or just doesn't want to admit that it hurts. And, the results aren't as good if you can't get them educated to say, nope, we got to keep it below 5.
Yeah.
Yep,
So,
definitely. So that's been an interesting part for sure. But yeah, from the medical side of things, like I've done nerve blocks, I've done steroid injections, I've been a part of knee surgeries, and truthfully, I don't have 37 years of experience. I'm not even 37. But just with my medical experience being in the hospital and being more on the conventional side, there truthfully is nothing like this. Because to me, you can get someone non-invasively feel better within minutes. Within minutes. And it's so freaking cool. And I've talked with StemWave about it a lot. It's just I feel like this tool allows just incredible emotions to come into play, because a lot of times we're dealing with really chronic pain issues that things haven't worked for. We see people with bone on bone all the time, and they're like, oh, nope, injections don't work. I don't want surgery. I'm hopeless. And this machine literally is hope on wheels. It truthfully is, because it's establishing hope for so many people that have dealt with chronic pain issues, chronic range of motion issues, limited range of motion with the shoulder, with frozen shoulder, those types of things. And so it's been just an incredible modality to bring into our practice.
And you can even take that to the next level, because when somebody, especially you get a little bit of age on them, and all of a sudden their knee is so bad that decreases their mobility, which then just starts that downward spiral into unhealthy aging. And when you can so it's so much more than just about that knee pain or just about that shoulder pain. Once you give them use of those things back, it impacts their whole life, and then their spouse's life and their kids' life and their work life and everything. So it just brings more goodness to the world. That's beautiful. Yeah,
I just want to go back to that about how often people will say, this is my last chance.
Yeah.
Otherwise I'm going to have to live with this I've done everything else. Just had one the other day we'll talk about in a minute, but yeah, it's crazy how often that happens, and people are just, it's the last hope. They saw it on Facebook, on some of the StemWave ads or something, but crazy stuff.
It is.
It's awesome, and it's just awesome to be part of a practice where we have a lot of things that give people those last hopes. It's amazing. This is one of our best for sure.
And again, I think the beauty of it is that you can try it, and it's not going to work for everybody or everything. But the beautiful thing about StemWave in particular, I think, is that people will, if it's going to work for them, they're going to notice a difference right away, either in pain or range of motion or both, ideally. And so that's a great segue. I mean, it's just come try it out. What do you have to lose?
Got nothing to lose.
And then if it doesn't work, then we have all of these other things in our back pocket. We will send you to a surgeon if we need to. That's kind of our biggest philosophy is we just want the best outcome for our patients. And this is one of the tools that we use, and it is so simple. It is an easy test to see if it's going to work for you. And then we'll know if it's going to be worth the investment of time, energy, funds also. And so one thing I do think that it's important to mention is that insurance is not covering this right now, unfortunately. And it is something that I think patients should know about, is that insurance companies don't always have our back. especially when it comes to,
Things that are really good for you.
unfortunately.
Don't involve drugs or surgery.
Yeah.
I think, again, with the whole idea of it's kind of amazing to me that how it's become our go-to on so many of these things, whereas a lot of doctors would, oh, you've got pain in the knee, let's give you a cortisone injection.
Yeah.
Which, can be magical, but at the same time, it's very detrimental to the health of your joint. So it's really cool to me to see how it has become really our first weapon with most of these, especially extremity conditions, but also spinal conditions. It's become, we need to map that person. That is happening more and more now because we just see the results.
Yeah.
Right. And if they're candidate, I mean, just keeping people out of surgery. I know just recently we've experienced 3 separate people who had knee replacements go bad, and just with infection, and then dealing with, IV antibiotics, immobility for months on months and months, and really looking at never having a knee that gets it back to normal. And it's just, I think that in the aging population, a lot of times now I'm seeing it's like, oh, my badge is I've got a new shoulder, or I've got a new knee, and it's just, we see the people that are successful with it, I think, more often than the ones who are not. The statistics on it are not what we would like to see at all. And there's a lot of risk involved. And, when you talk about insurance, yes, it's very sad because Medicare will pay in full for pretty much at the cost of out of pocket of about $300 for a knee replacement, but then they won't cover the things that will prevent it, which is very sad with our system right now. But hopefully that will get fixed somehow, some way. But
Somehow, some way.
yeah.
But let's talk about who's a good candidate for StemWave or Shockwave Therapy. And what's kind of your biggest take on that?
I would tell you, there are no bad candidates for shockwave therapy. But I mean, we can use it on acute conditions to speed up the healing process. We can use it on chronic conditions to break up scar tissue, to really turbocharge that healing process that's not happening. We can make it start happening in these chronic pain patients. So again, my take would be there's not very many pain issues out there that are not a good candidate.
Yeah. I would say the biggest thing for the mapping in particular is that it does work best for your brain and for everyone involved that if you have a provocative test. So, hey, doc, every time I do this, it hurts. That is a perfect StemWave candidate in my mind, because if we can replicate it in office and you can do a squat and it's like, oh, I feel my knees, or we can take you on the stairs. I've even had runners that only get knee pain with runs, and I'm like, go for a run real quick and then come back.
That's right.
Like genuinely, because we want you to, it happens so fast that sometimes it takes the brain a second to catch up. And you're like, did it actually work? I don't know. But if you can prove to yourself and the practitioners and everybody that it improved with range of motion improvement and or pain improvement with a provocative move, that to me is like one of the best things. There are circumstances like with neuropathy that like it probably will get better over time and you're not going to have that immediate response. Or if you're breaking up calcific tendonitis or those calcium deposits or a spur, we're going to tell you, hey, you may not notice a difference right away, but it's worth it because of the clinical evidence behind it to do more sessions.
Yeah, in those cases, I generally tell the patient, if I can find pain points, we can almost certainly help.
Yeah.
If we map somebody and there are no pain points, it's probably not going to help.
Yeah.
But that has happened, I can count on one hand of all of the patients I've treated.
Yeah.
And probably 3 fingers, basically.
Yeah.
You generally find the pain points. And when you find the pain points, we've got something to treat.
Absolutely. Another caveat that I've noticed is that if you, just patient education wise, if you go in for a Shockwave appointment and you're trying out Shockwave, it's really important to make sure that you don't take an anti-inflammatory beforehand. So you don't want to take Advil or ibuprofen or Aleve or anything like that, because it actually inhibits the response that we're trying to get with the Shockwave. And you can often go too high in energy because you're just like, oh, yeah, I can take more, it's fine. But in the background, your tissue is still getting too much energy, you're still getting too much stimulation. In those cases, you actually can see a flare.
What is the time frame? Say if somebody took Advil this morning at 6 a.m., can they do it at 6 o'clock that night?
I would say normally if it's within that day, I would say definitely within like 6 hours. Like if they've taken it within 6 hours of their appointment, I would say do it on a different day. It is not worth it because the potential of that you might get a flare up is actually very real if you're in that time frame. And it also depends on the medication. If it's once a day, like Aleve, you probably need to wait until tomorrow.
12 hours, 24 even. Yeah.
And so that's kind of my thing. My gestalt is I ask if they've taken it during that day. If they took it yesterday in the evening, most of the time it's okay. But, and then another thing too that I think is really important is how many treatments do we typically do? So,
So our baseline for treatment is 8. And the way we do that is twice a week for 2 weeks and then once a week for 4 weeks. Generally speaking, I will also tell you that we see these amazing results on the first visit, and very often what happens is all of a sudden you can move a joint better than you could, and you don't have the pain telling you not to do that, so you tend to overdo it. So very often people will do it and you go, yeah, but the pain came back. And I said, this is why. We took the pain away, and the pain's not telling you not to do that movement, so you did it, and there's repercussions with doing it. And so that happens a lot. But what I try to tell patients now is try not to. Baby it a little bit and milk that benefit as long as you can, because that's important. The longer we can keep that pain away, the longer the healing process is occurring. And I think that's really important. So that's just something I've just recently started doing is really telling patients to baby that a little bit and let's milk the benefit as long as possible.
Yeah, the indications that I learned also were that that pain reduction is only supposed to last after a first visit between 2 and 48 hours. And the length of time that it lasts is somewhat of an indicator as to how many treatments it's going to take in order to really get you healed to a place where, so if it lasts for 2 hours, chances are you may need 12 visits. If it lasts for 48 hours, you're probably going to be great with 8. I think 8 is usually the minimum that we look at, but I think that's important to let people know as well, just because, hey, this, if it feels so great, why am I coming back? Because it's definitely a temporary situation that needs to build upon itself in order to really make it
stacking those benefits.
Exactly. And that's something that people I don't think realize is that endorphins are temporary. I mean, it's the same endorphin release that you get when you're working out. You're not going to just high all the time.
Or a chiropractic adjustment. That's one of the big things with adjustments is it causes a huge release of endorphins. So generally speaking, you're going to feel a lot better.
Yes.
And some bodies are better at holding on to that than others. I mean, sometimes you're breaking a cycle, and once you break that cycle, it lasts. But more often than not, you can't fix the problem that quickly.
Exactly.
One thing I've also done initially now, it's like I always recommend 8 and say we can always add more. Because still, it's a learning process for me and understanding that, this patient needs 12. I'm pretty good, but I'm not that good. So the idea is let's start with 8. And this is the cost it's going to be. And if you need more, we can always add more. And the few patients that we have added more, are readily accepting of doing 4 more or something like that because they see what's been happening over the, 6 weeks that we've done it.
Yeah.
Right.
And that's my biggest question, because we always do a check-in at number 8 or wherever we kind of land. And we check in and we see, are you feeling like things are plateauing, or do you still feel like there's juice out of the squeeze?
Right.
That's my question all the time, is like, do you feel like there's still benefit? Because it genuinely should stack over the weeks. And if you do, then it could be worth it to go up to 10 sessions or 12 sessions. But if you're feeling good and you're like, heck yeah, I'm ready to go live my life, then you can do maintenance sessions.
Well, that was my next question to you, is what do you tell patients about how long it lasts when they go through the full 8?
Yep.
And will they need to do it again?
Yeah, and that's always a really good question. And I will say, I think people always want like a straightforward, yes, this is the answer. But let's be real. The couch potato, if someone goes and just sits on their couch versus someone who's running a marathon every weekend, those are very different circumstances. Very different. And then also, like, if you come to me as a runner with knee pain, we get your knee pain better, but then you have a bunch of marathons or triathlons coming up, you may need more than somebody else who's, hey, I only hurt my knee when I was hiking in the woods.
Especially if you don't change your mechanics. Like, say you're a marathon runner, but you're wearing crappy shoes, and that that was the problem. But you put those same crappy shoes back on and keep running. Maybe we need to address your shoe choice. I don't know. There's a lot of variables there. And one of the other things that we've started doing is doing some rehabilitation with it to strengthen that healed tissue. Now make it more stable so that your benefit will last longer. And the great thing about that is very often that's covered by insurance. So.
Yep. It's a combination of things. And that was what I love about our practice in particular, is that we take the best of all of these different worlds, and we also try to go through insurance for everything that we can, which I think patients really appreciate. But there are things out there that insurance does not cover, and they can be worth their weight in gold depending on what's going on with you. And that's our goal, is to really meet you where you're at and figure out, okay, do you want to just do insurance only, or are you open to these other opportunities, and which one is going to give you the best bang for your buck? Which one is going to make the most difference in your life? And nobody can answer that except for the practitioner and patient relationship. Because if we don't listen to our patients, then we're never going to know what actually is going to move the needle the most. And I think that's what we do so well, is that we spend time with patients and actually listen to what's going on. What is your actual goal? What would make the most difference in your life? Is it your knees? Because you can't lean down and play with your grandkids? Is it your shoulder because you can't reach up and hug your really tall loved one? Like, these things actually really matter, but unless we ask the question, we will never know. It's like, and especially if you're looking at it more from just I'm going to treat what I see on imaging, and that's it. I could go after your knees that look like crap on your image, but they may not hurt you. You know?
Yeah.
And so I think it's really important to have that more holistic care and a holistic approach to all of this.
And the flexibility. I think just to add to that, because, if we're doing something and we're not seeing the results that we have, we've got a lot of tools. I mean, so Shockwave is amazing, but there are people that Shockwave doesn't help. Or if the problem is more involved than just pain and range of motion, if we've got degenerative changes, if we've got some other things that, we have other modalities that we can use, and we can change course right in the middle of care, because it's like, well, if this isn't working the way we want it to, we have something else that we can try and see if that works better. And I think just having open minds and not being so narrowly focused. I think a lot of practices, even with Shockwave, I mean, you could get out there and be just in a strict Shockwave practice, and if that's your only thing you're doing and that's your sole focus, you're not going to get as much benefit as you would from somebody who's really looking at the whole big problem and the whole biomechanics and the whole everything, so that we can come at it from different directions to get really the best results possible. So
definitely.
Going back to the cost a little bit, I think the one thing I tell patients all the time is they say, look at the cost and say, oh, and I say, look, this is an investment in regaining your life. And it really, when you look at it that way, it's a drop in the bucket. It's to be able to do those things, like you said, pick up your grandchild. And I've heard that, I can't tell you how many times I've heard, I want to pick up my grandchildren. And I can't imagine if I couldn't pick up my grandchildren.
Yeah.
It would be worth any amount of money to me.
Right.
But the Shockwave is relatively inexpensive when you consider it in that realm.
Well, even if you consider the longer term effects.
Yeah.
So if somebody loses their mobility, their health costs are going to go up so much as they age. And that's our overall goal here, is to give everybody the best chance they have at graceful and mobile aging, so that they can stay active, because that is going to cost a lot less money in the long run than not taking care of it and starting to fall into that trap of this is wrong and that leads to this is wrong, which leads to this is wrong and this is wrong. And just not only a not as highly functional life, but also far more medical expense.
Yeah, and building on that, the less you move that joint, the weaker your muscles become, the greater your chance is at falling. We mentioned earlier in the last podcast about, I don't know that you mentioned the statistics on that, but if you break your hip at 65 and are hospitalized, a third of those people die in a year.
Yeah,
that's crazy. And if we can give you back that mobility of that leg, so you can strengthen it and stabilize it, we're going to keep you alive longer.
Yeah.
This is,
and keep your grandkids happy.
Yeah, definitely.
Yeah.
So I think this is a great segue into sharing some of our favorite StemWave stories. And I know Dr. Bob, he's hot off the press with one.
Hot off the press. I'm getting weepy just thinking about it. This was one, I literally sobbed with this woman on this past Friday. Beautiful young girls. She was about to turn 50, waitress for 30-something years. And she said what I said, I hear all the time. She said, "You guys are my last hope before they want to do knee replacement." And so I felt really good about it going in, because observationally her knees looked pretty good. Palpation, she had a lot of, when I pressed on the tissue, she reacted pretty strongly. So Michelle was helping me. We mapped to one knee, and she had a low pain tolerance, so we had to really manage the volume, but we kept it in a spot. We did the other one. Again, this was probably a 10-minute process, and when she went to stand up let me back up a little bit and talk about her provocative motion was squatting. And I said, "Can you squat?" And she said, "If I hold on to something." And I said, "Well, hold on to my hand and hold on to the table." And she probably got a 20 degree maybe squat. And it was, 7 or 8 pain when she did it. So when we did the mapping and we did the treatment and she went to get up, I was a little bit disconcerted because it looked like she was really struggling to get up. And I said, "Well, let's try the provocative motion again." And I'm telling you, the woman went down to like 90 degrees. And she just started crying, and she looks at me, she says, "Can I do that again?" And I said, "Yeah." She goes, "I don't want to hold on this time." And she literally went down into a 90-degree squat. And I said, "What's the pain?" She said, maybe a two. I can do this." And then she looks at me and says, "Can we go do the stairs?" And she went up and down the stairs, and she is just sobbing. And so I had this discussion with her. I said, "I know you got to work this weekend." "Yep." I said, "You really got to, I want you to baby this, because I really want you to milk this and get as much benefit as you can." Yeah. Monday evening she came in and she was just grinning. And I said, "Did it last?" And she said, "All weekend, I still feel great." So, killer. Every time.
Yeah.
Man. Life-changing for her.
Yeah.
So.
Pretty good. I know. I'm tearing up over here. This is real.
It is real.
I told StemWave this.
Oh, by the way, her name was Dave. I don't know if you guys saw the first podcast. We talked about a patient whose name was Dave. So I think that'll be our go-to.
Our go-to
pseudo-name
for patients will be Dave.
How is Dave today?
But yeah, I told StemWave that I don't think any modality in this office has made us or patients cry more than StemWave.
No question.
Like,
All good
hands
cries.
down.
All good cries.
And just those emotional, like, this is why we do this, like, to help people get their lives back. And I mean, it's just been so cool to have this technology. We've gotten people out of wheelchairs. We have gotten people out of wheelchairs and dancing. We have had so many people throw away canes and walkers. And
we have a card just today. Thank you for changing me from changing a couch potato into a street walker.
Yeah.
A thank you card from a patient. So
Yeah.
just that, it's amazing.
Yeah.
This is
That's
a
pretty
man
cool.
in
Couch
his, a man in
potato.
his mid-80s who's, as it happens, his name was also Dave. But the card said, "Thank you for changing me from a couch potato into a streetwalker," and he's in his mid-80s. And the man is just bounding in here now, and he was in such agony when we started treating him. But he's one that we've done a lot of different things too, including Shockwave. But I believe Shockwave was really opened the door to him getting well, and it really helped us treat him. And that's something I want to touch on as well, is how often the Shockwave allows us to treat people faster, because one of the first things we do when we treat chiropractically or medically, we got to get rid of the pain, because getting rid of the pain is the first step in you being able to move correctly, because we are all about moving correctly first. That's very often in the physical therapy world, not all physical therapists, a lot of physical therapists take the tack, if we make it stronger, it'll get better. But one of my mentors talked about the fact is that if you do this and it hurts, your brain is going to make you do this, and you develop a whole new faulty movement pattern. So the idea of giving us this doorway into getting that pain down faster just allows us to treat and get patients better faster.
Yeah.
And it's an amazing tool.
Yeah, and it's the classic way of thinking about this. I mean, even just in conventional medicine, how medical students are taught and residents are taught is that you have to, most of the time, if you have a musculoskeletal injury, you're going to do some sort of pain management, right? Maybe a steroid injection, maybe a medication, if they need it. And then they go to physical therapy. And if those things fail, then they typically will go to surgery. But here's the deal, is that medications and even steroid injections can have negative detrimental side effects. And this doesn't have those. And that's what's so cool about Shockwave, is that you can get that same philosophy of let's get it feeling better first so that you can do physical therapy, but you don't have that negative side effect. You don't have the potential GI bleeding that you might have with an NSAID, which is just an anti-inflammatory medicine. You don't get that cartilage decrease, the reduction, the degradation that you can see every time that you get a steroid injection.
And the bone necrosis. I mean, steroid
Yes.
injections, people really need to understand what they're doing when they do them, because yes, it might feel better, but it is absolutely 100% increasing the cause and the problem. And over time, it will drive you towards surgery, because there
Those
won't be other
modalities
options.
like that, like steroid injections, while they're very often, when they work, they're magical at reducing pain, but the same thing happens without the healing effect, is that you take away that. One of my favorite Dr. M sayings is, when a steroid injection is like the hot light comes on in your dashboard, instead of putting water in your radiator, you just put a piece of tape over the light. And so the engine continues to burn up. Whereas with StemWave, you're actually creating a healing process. And that is so totally different than, the mainstream medical approach to this.
Absolutely. Absolutely. And I think, again, it's all just about making educated decisions. And that's what we're all about. I mean, I still do steroid injections for people, but educating them on the risk and educating them, hey, this is what potentially can happen. Because a lot of times, unfortunately, doctors just don't have the time to go over a real informed consent. You sign a piece of paper without even looking at it that says all of these things on it, right?
I've had multiple steroid injections in my life before I realized how bad they were.
Yeah.
And not once did anybody tell me that there was harmful issues
yeah.
associated with it.
Yeah.
Not once.
Yeah.
And we
so-
can give you another one in 3 months or so.
Yeah, yeah. And so it's definitely something just to educate yourself about, know that there's alternatives out there, and know that some of these alternatives can be even better than what we've had before in conventional medicine.
Right.
And that's what the beautiful thing about this is that, like, it really depends on your goal. Like, is your goal to actually heal the problem and to fix the problem underneath, or is it just to get out of pain so you can go to a wedding this weekend?
Yep.
Very different. And so it's very much, again, about educating people, about just realizing what is your goal, and just as a whole, knowing that you have more options than just the conventional medical way. So.
Dr. Ann, I think you mentioned you had a patient you wanted to talk about. Oh, maybe you were talking about the wheelchair one was I think maybe.
No, I think Dr. M had a patient, though. Did you know?
I can.
Yes.
Yes. So also named Dave.
I have a few Daves, but I had not said that, so
Yeah.
I will let her do
Yeah. One of my favorite ones that was a very emotionally touching moment was actually one of the family members of our staff.
It's one of the ones I was going to talk
And
about.
that she actually came in from out of town, like
Minnesota.
And came in, was on her last leg, was also talking about getting surgery, just absolutely miserable because conventional medicine hadn't worked for her. And she had been doing all the things. She was getting an injection, she was seeing pain management, she was doing all of the things. And
now was depressed on top of all of it. Yes.
absolutely.
Yeah, absolutely.
And just, it's really incredible just how much pain can debilitate someone from their day-to-day life.
Yeah.
And it's a very real thing, and people do not feel themselves when they are in that much pain. And
she was a school teacher. That's just an interesting thing because I think the week prior she had had a child fall on the playground, and where she would normally have picked that child up, she couldn't, and so she had to ask one of the other students to help the kid up, and she was just so, those kinds of things were just so devastating to her, and it was just.
And so for her, we did a combination of therapies, including osteopathic manipulation on her sacrum, and then we did the Shockwave. We did StemWave on her sacrum and her SI joint. And it was so cool to me because we actually had her scan her feet. And we have a foot scanner here that can actually map out the pressure of your feet and tell us exactly what's going on with your posture and kind of your whole kinetic chain alignment. And she bent down after that machine.
I remember this,
and she picked up her shoes. And she stopped in the middle of it and was like, oh my gosh, I haven't bent down like to touch the ground in like a year.
Yeah.
And she just bent down and picked up her shoes like no problem. And just the look on her face, I will never forget. So cool.
Yep.
Yep.
But it's just, it is really incredible that, like, again, it's just these treatments and the way that we approach things is just more holistic. And it's just a beautiful thing that we can combine these things to help people get their lives back.
Yeah.
And that's what I know gets me going. I know that's what you guys instilled in me as, like, why we're in healthcare, why we're here.
Why, to begin with. And, you know, starting off with just chiropractic as our tool, which is an amazing tool in and of itself, but looking at, I am so grateful to be in a place where we can explore all this innovative technology and, you know, in coming up with our new name branding to be Pinto Innovative Health and Wellness. I feel like it really embodies who we are because we want to explore these new technologies and not every little gadget that comes along, because that, I think our world is flooded with that right now, with gadgets and information. And, you know, I think probably everything has a little something to be said for it, but I think, you know, the magical marketing and all of the things that people are doing to convince people of things. But for us to have the backgrounds that we have, the tools that we have to truly explore these new innovative technologies, because we know that things are going to get better. I mean, that's always been the way of the world when you look at how medicine has advanced, and to not be stuck in the institutionalized world where, you know, it's harder, it takes such a process to discover something new and make a new change. Just to be in this situation and to be able to offer this care to patients, which is so life-changing for them and for us, you know, so.
Well, to finalize things, what I would like to say is, if you got a problem, it's only $49 to come in and get mapped, and you'll know right away.
Yeah.
So I would encourage you, give us a call.
Give us a call. And if we're not in your area and you are dealing with pain or range of motion and you feel like Shockwave potentially could help you, look it up.
Yep.
Find someone near you.
If you're further away than Minnesota, we probably right?
Absolutely, absolutely.
Yeah, but
We'll see you.
actually, even if you just have a question, if you call our office, we would be more than happy to see if we can fix you up with a provider that is, you know, trying to do the same things that we are in your area. So we just want to make the world a healthier place, one patient at a time.
Absolutely.
Yep.
All right, if you enjoyed today's episode, please like and subscribe, and we will be in your content, and we are so excited to be on this journey with you. We are so excited to just educate and spread the love and the health. And remember, you're built to heal.